Good morning. I'm Wendy Doyle, President and CEO of United We. Welcome to the release of our study focusing on childcare licensing in Kansas. Thank you all for taking time out of your day to join us. Please save your questions as we will have time at the end for Q&A. And if anyone has a note-taking bot, we know this is trending, we're going to disable those at this time. Today's webinar is being recorded and we will send it out following today's presentation. Advancing economic leadership for women is our North Star at United We. We know there are many barriers holding women and families back, but childcare is a significant workforce development issue facing Kansas and most states across the country. As many have heard or experienced, childcare is extremely expensive and is difficult to find at times. Additionally, economic barriers for childcare providers are significant. They are struggling to stay open, meet licensing requirements, and pay a living wage to their employees, as an example. To gain a better understanding of the challenges and barriers, United We conducted multiple focus groups of childcare providers. We wanted to listen, we wanted to hear, and we wanted to learn. And what we learned from providers is the amount of paperwork to do business is burdensome and can take hours of dedicated staff time. Based on our learnings, we knew as an organization we were best fit to look further into licensing regulations to better understand the barriers impacting the availability and viability of opening and operating a childcare business. Keeping in mind, health and safety of children is our primary focus, but we wanted to investigate actually doing the business of childcare. This has led to the Kansas research we're releasing today. A big thank you to our generous funder who helped make this research possible, the Patterson Family Foundation. Now, I'd like to share a little more about United We and then introduce our guest speakers. At United We work to advance all women's economic and civic leadership to make meaningful change. We've been working for 33 years to unite people around nonpartisan policy issues to empower women and their families. It's a team effort, and we've been fortunate to have research and funding partners around the country, particularly here in the Midwest where we are based. As a nonpartisan think and do tank, the way we advance our work for change is through a simple but impactful approach. Research, use the research to come up with solutions, then get to work to get results. Our policy lab is an initiative born from a powerful vision for change across 4 states: Kansas, Missouri, Oklahoma, and Arkansas. The lab provides actionable research, innovative solutions, and meaningful results to drive systemic change for women throughout these states and beyond. By setting a template for nationwide change, we are paving the way toward a brighter economic and civic future for all women. As part of the Policy Lab, we've recently released similar research in the state of Oklahoma and Missouri just this last month, and we're releasing Kansas today, and we anticipate Arkansas early next year. I also want to briefly touch on our Women's Entrepreneur Childcare Project that we recently completed, which is an effort to generate awareness and ideas to reduce the childcare barriers limiting women's entrepreneurship. As part of the project, we commissioned a high-level review of state-by-state licensing regulations and certain aspects of their implementation across all 50 states, the District of Columbia, and Puerto Rico. The study lifted up best practices across 4 aspects: content of licensing regulations, licensing fees, availability of information on the licensing process, and frequency of licensing renewal and inspections. You can find this full report and our state-by-state profiles, including the state of Kansas, on our website at united-we.org. Now, I'd like to highlight our speakers and researchers participating in today's discussion. First, we have House Majority Leader Chris Croft with the Kansas House of Representatives representing District 8. We also have Dr. Misty Hageness, co-director of the Kansas Population Center and associate professor of economics and public affairs at the University of Kansas. And finally, we have Paula Neth, who serves as president and CEO of the Family Conservancy, a nonprofit organization that's working to represent our providers across both sides of the aisle. So with that, both sides of the state, sorry, with that, let's hear from Majority Leader Croft. We also are appreciative of his support and dedication to advancing women's economic development in the state of Kansas. Majority Leader Croft, thanks for being here, and we'll let you take it away.
Hey, Wendy, thanks for having me on today. And I so appreciate all the work that you guys are doing. United We and the Patterson Family Foundation, you guys are great. Thanks for what you do. I've been to several of your events, your award ceremony, incredible. The business roundtable where you presented to us, and over in the Overland Park Chamber as we ran several task force or discussion groups on childcare and how do we make sure that we address this complex issue. As you know, from being the guy that kind of pushed the occupational licensing bill for Kansas, I'm always trying to look at barriers to what we are doing and trying to see how we can knock down those barriers. You guys are doing the exact same thing, and I think that's why I'm so happy to be a part of at least just even being able to do this with you and just to show my appreciation to all that you guys are doing. This is a big deal. And I will tell you a quick story. Some of you guys may have heard it. When I was in high school, it was in the middle of the night, and we were trying to figure out how we could go march in a parade up in D.C. I was in the marching band, and we'd never been outside the state of Florida and wanted to go to Washington, D.C. for the Cherry Blossom Parade. And we did all the typical fundraising ideas, and they were not going to get us there. And somebody in the back of the room said, "We should shut corn." And I was like, "What? What is that? How does that all work? And how does that fundraise?" And you know what? It was that idea, which many people discounted, that became the very function that got us to go march in that Cherry Blossom Parade. And I still remember all of that today. And that's why I think this is important. This is a very, very complex issue. There is no one problem. There are multiple problems in here. There's multiple things that we need to do. And it's so important that we have the discussion about different ideas and be able to share, because not every idea is a good idea, but you never know which one is until they put it out there and they feel the ability to do that. And I think that's what you guys have done here and gone through and researched and looked at all these different ideas and kind of present them. I just got to tell you, this is so important, and I'm happy to that we're going to go after some of these things that are in here. I don't know which ones yet. We're going to look at it. We're going to talk about it. And the bottom line at the end of the day is I want to solve real problems. I know you guys do too. So we have real outcomes and we continue to improve this state. This state, Kansas, is no longer a flyover state. Many people have said that, but it's truly not. We have great infrastructure. We have unbelievable schools, but we're stagnant on our growth, and we need to change that. And I believe that the one way we get to do that is by changing how we do the child care and how we make sure that it's available for everybody so everybody can achieve an opportunity here in the state of Kansas. And I'm so looking forward to everything that's in here and what we've got to do and what we're going to do in the next couple of years. So again, thank you guys very much.
Thank you, Representative Croft, for your leadership, your service, and for being a champion for all that you do for state of Kansas. And we look forward to working with you to put this research into action and get some results. We know you have a tight schedule and may be lifting off, but we thank you for joining us today. Now, let's get to why we are joining and get to Dr. Misty Hageness to walk us through the research report. So thank you, and we'll turn it to you, Misty.
All right, thank you. Thank you so much, Wendy, and I really appreciate this opportunity, both to conduct this research and then be able to be here to present this research to all of you. So we conducted a study and wrote a report on childcare licensing in the state of Kansas within the context of why do we care about childcare? And it is deeply tied to what Majority Leader Croft just mentioned in terms of economic growth and economic development for the state. Figuring out solutions to childcare is one way in which we can help accelerate economic growth within the state because that provides more opportunities for folks to get out and work for pay. So just to make sure that we are all on the same page here, childcare is very broad. It encompasses lots of activities. Families provide unpaid family child care to their children and relatives all the time. But this report is specifically focusing on licensed child care facilities. So we'll talk a little bit about home licensed facilities and center licensed facilities. Okay, next slide. All right, so the big takeaway in part from this report is just an understanding or an awareness of the parameters around licensing in the state of Kansas and the costs associated. So we surveyed all of the counties and local jurisdictions where based on the way in which each of them licenses childcare facilities in their local areas. And so there are counties that use the KDHE system, and then there are other local government, municipalities and counties that develop their own system. And the local government gets to choose. So they can decide whether they want to just kind of buy into the KDHE system or develop their own. And what ends up happening or what has happened in the state of Kansas, because there's this ability at the local level to decide, there is a variation in the costs associated with getting a home-based childcare licensing fee and center-based licensing fee. But for home-based licensing fees, for an individual who is entrepreneurial and wants to start a childcare operation in their home, the costs are going to range anywhere from $133 to $373 per year, depending on where they live. And for some folks, that means that they're living on a border county where if they were on the other side, it would cost $133, but because of the side they're on, it costs $373. So there's variation there that, could be creating some kinks in the system and could be pushing some folks out in certain areas where it's not pushing them out in others. It takes approximately 30 days to get a license once all the paperwork is completed and submitted to the state. The state actually recommends that you start the process and expect it to take about 90 days from the time you started the paperwork until the time you get licensed. And so 30 to 90 days, if you're an entrepreneur and you're wanting to start up a business, having to wait 1 to 3 months, could have an impact on your willingness to get the business up and running and to get started. And then the other piece that isn't directly related to the business of licensing, but I think from a policy perspective is important to understand is that, and this isn't unique to Kansas, infant care is often unprofitable. And that's true in center-based childcares, but it's especially true in home-based childcare. And so what happens is there's a disincentive to license for infant care because just the profit margin isn't there. It's very expensive to take care of infants. And so if the state or if policymakers are looking for a targeted area that they could focus on that might have a big impact on, or at least an impact on economic growth in the state, and they're looking at all the options for childcare, focusing on making infant care more attractive to small businesses would be a good idea for many reasons. I'm happy to discuss more about why, and I will, I think, in the other slides. So let's go to the next slide. Okay, so I just want to say a couple of things about households. In recent years, childcare costs have increased at basically almost twice the rate of inflation. That's a national estimate. It's true kind of across the board throughout the country. If parents cannot find infant care, just care generally, but specifically if a new parent can't find infant care, it really affects whether they use childcare as their children age. And it also creates challenges for parents to return to work when their kids get older and they try to put them in care. So there's two issues going on here in terms of, or two ways in which having better and broader access to infant care is useful for communities. One is that it keeps that it kind of mitigates the hit that parents take on their future earnings when they do return to work, creates a smoother process in their workflow. But then also, it's if kids get into infant care, they're more likely to stay in care, and there are benefits to children related to the socialization and development skills that they learn in an early childhood education setting. The average infant care for parents, this is what I was mentioning earlier, costs between 8 to 13% of their median household income. And that's in the state of Kansas. You can go to the next slide. And so this is what that looks like. And you'll see in the report, we've got a handful of maps in the back of the report. And this one, I think, is in the body of the report. But this is the median cost of infant home-based care as a percentage of median income in Kansas. And so you can see that there's variation anywhere from 7.5 to 13.4% of a median income for a family in Kansas. And next slide. So the one thing that I want to just mention is that the U.S. Health and Human Services, Department of Health and Human Services recommends that households don't spend more than 7% of their household budget on childcare in order for childcare to be considered affordable. So there's not one county in Kansas that has affordable childcare for infants based on the median household incomes. And that's also true for older children as well. And if I don't have time to go into those numbers now, but if you looked at the map in the back of the report, you will see that. The one thing I will highlight is that home-based childcare is more affordable for families than center-based childcare. And so in thinking about the licensing structure and the additional challenges that entrepreneurs face in getting into the childcare business and having a childcare center based in their home, it is beneficial not only to reduce those, well, it's beneficial to reduce those barriers for the home-based centers because those tend to be more affordable for families as well. Majority of families in Kansas live in dual earner households. So 70% of married mothers work for pay outside the home. That's mothers with kids under the age of 5. So this childcare issue is a broad issue that affects the majority of households in Kansas. And then we went ahead and calculated something called a dependency ratio, which just looks at, it compares the number of minor children plus people over age 65 to the number of prime age worker age adults, which is going to be, in this case, age 18 to 64. And can you go to the next slide? So there's dependency ratios, meaning that, higher levels of care are going to be required from working age adults in communities that have higher dependency population or dependency ratios. And so just pointing out here, there's kind of a couple of extremes here. In Riley, there's less individuals in Riley County, less individuals compared to other dependent children and adults. Riley happens to be Kansas State, so there's a university there, same with Douglas County, but you look at someplace like Jewel, for every one working age, prime age adult, there's one person there who could potentially need care. And so over towards the west of the state and northwest of the state, we have higher dependency ratios. It's more of a challenge for working age adults and more of a necessity, not only for childcare, but also considering elder care issues. All right, next slide. So we have recommendations, again, that are kind of fully fleshed out in the report. I encourage all of you to look at them. Couple of things that we are recommending based on conversations that we've had with people across the state. One is to remove bottlenecks in fingerprinting. There are locations where you can only get a fingerprint. You need to get a fingerprint to get licensed, and the fingerprint operation works. For example, in the sheriff's office, they only allow you to come in and do fingerprinting Wednesdays from 1 to 3. And folks who want to start up a smaller, an entrepreneurial childcare business in their home are often working other jobs until they can get that started. So it's challenging when the timing is really limited. One idea that was brought to us was, could we move fingerprinting operations into public libraries? And so there's more flexibility there, more hours in which somebody can go get fingerprinted. Focused investments in childcare and childcare innovations would be really important and probably have a really good bang for our buck in terms of thinking about this issue moving forward. And then studying viable options for streamlining the cost of licensing throughout the state. One thing that we repetitively heard was the challenges associated with what local governments decide to do in terms of licensing for childcare. And then just continuing to recognize and bring awareness to this idea that the state right now, again, if we're thinking about investments in economic growth and development, figuring out solutions so that there is better, more quality childcare for workers is going to help us increase the number of workers we have in the state and increase economic growth and development. Next. And that's it. So here you can find the report.
Misty, thank you so much for that overview. I think for our audience, we just scratched the surface with the data that's in the report. So as Misty said, please, we encourage you to download this, to access it on our website at united-we.org. There is a lot more data in there, but thank you for all your work that you've done on this important report. Of course, there is, as we've talked about with House Majority Leader and as what Misty has identified with the research, there is no magic wand to solve the childcare issue. That's where the power of collaboration and collective action comes into play. So again, this is a research report that we invested in, but doing this for, we want this for everyone. So please take some time to review it. Now, I'd like to turn it over to Paula Neth for a few words about what she's seeing in the childcare space and hearing from providers. Paula?
Thank you so much, Wendy and United We, for continuing to bring attention to this critical topic. And thank you for inviting us to join you today. As you're hearing, childcare operates within a very fragile business model that is currently a market failure across our state. It's an essential business that is critical to our economy, yet it's misunderstood and underfunded. And while there's certainly not a silver bullet, as we keep saying, to solve our complex childcare issues, focusing on business owners themselves is such a great place to start, and really unwinding and untangling what does it mean to be a business owner in this space. And we know rules and regulation are critical to ensure the health and safety of children, and high quality care is one of the biggest indicators of kindergarten readiness. So we should never lose sight of safety and quality measures. But our early education workforce is struggling. As evidenced in this research, there are barriers to even accessing tools our providers need to get licensed. But I want to return to that flawed business model for a moment. We need to keep in mind that these are small businesses that have to keep their costs low to remain affordable for the families they serve. This often means they can't offer competitive wages or benefits to their teachers. The trend of teachers who have had to leave the field for better paying jobs and benefits continues to increase as costs continue to rise. And efforts to open new childcare centers to serve more children are essential, yet many existing providers are forced to close their classrooms because they can't find and retain qualified teachers. This leads to lower revenue for the program and a shrinking supply of available childcare. And currently, many providers in our community operate at 75 to 85% of capacity. Meanwhile, costs are rising for both families and providers, widening the gap in access to quality childcare. Without action, this rift will only grow. Our hope is that this research will inform and educate others to really drive solutions to address these systemic issues and support the sector sustainability. And as we look and examine the policy considerations mentioned in this report, investing in early care and education offers the highest return on any investment Kansas can make. It leads to better high school graduation rates, increases the likelihood of children attending college, and boosts their chances of entering the workforce with higher earnings. High quality early care and education are essential to safeguarding the health and well-being of the children who will shape our next generation of workers. And in the state of Kansas, we have seen what can happen when investments are made and children and families benefit. So now's the time to continue investing in childcare, because we know when working families have access to reliable, affordable, high quality childcare, everyone benefits. Employers, parents, and most importantly, our future workforce. It's a win for all of us. So thank you once again, Wendy and United We, for highlighting this critical role that childcare plays in fostering economic growth and supporting thriving families and their children in Kansas.
Thank you, Paula, and thank you for your leadership, expertise, and support, and all that you do for the sector. We have a couple of minutes for questions, so we invite you to drop your questions into the chat, and we'll facilitate those. And while we're waiting for those questions, I think the first question is directed to Misty. And Misty, was there anything significant or any, fact that surprised you when you were putting this report together?
Thanks for that question, Wendy. I think a couple of things that surprised me were just the incentive or disincentive for infant care, which is why I wanted to highlight that at the end of the day in the report. And in addition to that, I would say the variation in local government systems in the licensing process. I think that's something that if there's a way to kind of standardize or streamline that process, I think that would be really beneficial to entrepreneurs who are interested in starting childcare business in the state, wherever they're living.
I think that's a great point. And just, the ability to share best practices, at all levels of government in the state of Kansas to really kind of unify the process. We could see some efficiencies, but just the knowledge base across the state would be exceptional too. We've got a question from Dr. Bartonek. So good morning. Do you have any idea of how many daycare spots we are short across the state? Does that vary greatly by county? And thank you for your work. Misty, I would direct this question to you.
Yeah.
Yes.
So where I would look in the report is the dependency ratio maps. You can see that there is variation. That doesn't speak specifically to the slots that are available versus how many of those are filled. We can get that information to you, and I can't remember if that made it into our report, but the data is available, so we'd be happy to provide it to you, and there is variation across county.
Thank you, Misty. A question from Brittany. Are there specific actions or programs you're seeing large employers participate in to support their employees? I'm going to ask you, Paula, to help with this response. But Brittany, just as a knowledge base, the state of Kansas does have a corporate tax credit to support large corporations and just businesses in general. And that tax credit is for childcare, to either open up a facility on site to provide, a support for the employees, or a stipend to employees. But what we're seeing too is just, more and more employers having empathy, I think is a key thing, a key takeaway too, as a result of the pandemic, and just recognizing the challenges families are facing in the workforce, looking for and maintaining childcare. Paula, anything else you'd like to add?
No, thank you, Wendy. I would say that we do have a toolkit on our website at thefamilyconservancy.org that can help employers better understand the tax credit and how they can use it and how it can benefit them and their employees. I think a lot of it is just lack of awareness and understanding of the benefits of providing this support to their employees, but also then how do I take advantage of that tax credit?
Thank you. Thank you, Paula. And I would just advocate that's a great tool and a resource. So please, Brittany, access that. We have one final question here. Good morning. Childcare Aware of Kansas maintains data on current childcare slots available too. So thank you. Thank you for pointing that out too. Are there another one from Brittany? Are there specific actions or programs you're seeing? We've already covered that one. Who is exempted from being required to get a license? For example, religious organizations. Misty.
Well, in terms of a business model, my understanding is that everyone needs to be licensed. So, if you're a grandparent and you're watching your grandchild, you don't need to be licensed. But the rules in the state of Kansas is that anybody who's providing childcare needs to be licensed. But we can double check and verify that.
And one final question before we wrap. Did you see significant differences in the needs between rural and urban areas? Misty.
Yeah, so there's more of a need in rural areas. The challenges are greater just because of, there's less population density. And so it is harder, I think, to start up childcare centers in rural areas, and there's less of them available for families.
Great. Thank you, Misty. And we have dropped in the Family Conservancy link into the chat. Thank you, Melinda. I'd like to conclude by thanking Dr. Hagenes for your great research report here. Again, to our audience, please access. We invested in this for you too. So please access and review it. And a special thank you to Paula Neth for your support and leadership and all the work you do for the childcare sector. And a special thanks to House Majority Leader Chris Croft for joining us this morning. As we know, our research is meant to drive policy changes that will remove barriers to benefit Kansas women and families so women can meet their full economic potential. So we take this as a call to action for United We in general. We want to roll up our sleeves, use the data, and get to work for some solutions. Thank you all for taking time out of your day to join us. We wish you the best holiday season and look forward to seeing you in the new year. Thanks, everyone.